Watch this.
We all saw Friday's abortion decision coming, which is why our neighbors to the west have been working ahead, setting up a fund for women, including those from Idaho, who may need to seek abortion care in the Beaver State. Thousands of jobs left unfilled in Idaho, including, and probably most prominently, in the healthcare sector. The problem isn't going away. In fact, it's getting worse. The pollinator populations have been plummeting for a period of time, but there are signs of hope, including how Boiseans are helping the cause in cleaning up the parks. The fallout from Friday's Supreme Court decision is still being sorted out across the country. Going across the border is now the new reality for a lot of women. For Idaho women looking for reproductive care, which includes abortion, that might mean going across the border to Oregon. Idaho's triggered abortion ban would outlaw all abortions in the state. Now, there are exceptions in cases of rape or incest that have been reported to police. By the way, only about a third of sexual assaults are reported to police. There's also an exemption for medical or emergency medical care to save the life of the mother. Advocacy groups in Idaho, like Planned Parenthood, are taking steps right now to create resources so women can travel to other states if they do need an abortion. Joe Paris joins us now. And Joe, you also learned that a state not named Idaho, which would be Oregon, creates these creating resources and kind of investing in solutions to help Idaho women seek out the care they need.
Yeah, it's a really interesting situation here where you have the state of Oregon really working to help Idahoans, something that you may not see. It's good neighborly work, I suppose. But that place, as we talked about, yeah, our neighbors to the west, Oregon. And back in March, the Oregon legislature, they passed a bill that created a $15 million fund called the Oregon Reproductive Health Equity Fund. And that fund is meant to create a variety of resources, and I'm quoting here, to close existing gaps in reproductive health care access and in preparation for an increase of people seeking abortion care. And that includes people here in Idaho who will now likely have to travel to Oregon to get abortion care. And lawmakers like Oregon Representative Andrea Valderrama pushed for Oregon to dedicate millions of dollars for the fund. So yes, Oregon tax dollars will go towards helping Idaho women who seek abortion care. So the question here, why? We spoke with the representative earlier from Oregon.
The intention behind this fund was to close the existing gaps that we currently have in our reproductive health care network. And so whether that means that those are for Eastern Oregonians who currently don't have any infrastructure, whether that's for a resident in a neighboring state, we believe that everyone deserves this access and care and the opportunity to plan their family and to have access to abortion. And so we took all of that in mind to put forward something that was meeting the needs of this community and really of this country in this moment.
Another factor in this, as you heard the representative allude to, are people living in Eastern Oregon. You may not know this. The closest resource for abortion care for those living in Eastern Oregon was Boise. Planned Parenthood is working to open a clinic in Ontario, but until that is set up, women in Eastern Oregon could have to drive hundreds of miles to the west to get care. The closest looks like Bend, Oregon. Now, the fund factors all of that in. So how does this program work? Well, the Oregon legislature set up that $15 million fund, which is also encouraging people to donate to it. And that fund is now in the care of the 501c3 Seeding Justice. And the legislature appointed that group to distribute the $15 million to address immediate and urgent patient needs for abortion funds and practical support, things like travel and lodging, and also to expand their provider network capacity. So $15 million was set aside in total. $1 million of that $15 million was actually pledged this past week to Northwest Abortion Access Fund. Now, Representative Valderrama has this advice for Idahoans looking to connect with the resource.
For someone to reach out to an organization that is most accessible to them. And so if they have relationships or if they're able to get a hold of someone at the Northwest Abortion Access Fund earlier, then that's great. If they're able to find someone at Planned Parenthood or through the Seeding Justice Fund, then that's great. That's great as well. I think we want folks to be able to ultimately get those resources in the fastest way possible.
So the theme right here is the regional care and the regional support state to state. So also of note in our region, the western states, California, Oregon, and Washington, has agreed to what they are calling a multi-state commitment to reproductive freedom. And points of that commitment include the following. I want to show you some points. Now, they want to protect against judicial and local law enforcement cooperation with out-of-state investigation, inquiries, and arrests regarding the provision of receipt, of assisting or obtaining an abortion and other reproductive health care services that are legal in those states. The states also, Oregon, Washington, and California, have this commitment to refuse non-fugitive extradition of individuals for criminal prosecution for receiving legal reproductive health care services in those states, Washington, Oregon, and California. And to be clear here, Brian, those points I just talked about, basically that those western states aren't going to cooperate with other states that are looking to criminalize abortion, it's really not written specifically about anything that Idaho has done. So those points I just mentioned, they're not directed specifically at Idaho, but when you talk about, criminalizing someone who would go over state lines and do something legally in one state, which is illegal in another state, you kind of understand where this direction of the conversation is going. Is that going to be the case in Idaho? Or Idaho lawmakers going to do something like that? We'll have to wait and see. But we have seen lawmakers across the country suggest or start to work on legislation that says if you do not follow our laws and you go over state lines, we're looking for options on how to hold you responsible for that. So it'll be interesting to see where this conversation goes. There's also constitutional questions, Brian, about if that would even be legal under the United States Constitution.
Okay, so I can understand if you go into Ontario and you buy some marijuana, you bring it back to Idaho, that could be a problem. You go over to Ontario and you smoke some marijuana and you come back, they can't prosecute you for that.
No. And it's an interesting test case. There are situations where you can get certain abortion medications through the mail. And there's questions about if you're in Oregon and you were to send it to a patient that got it over the border, what type of interference would that be? Would that be legal? So there's a lot of different directions this needs to go. As we've learned over the last few days, there's a lot of unknowns.
Yep, and as we learned from Representative Megan Blanksma on Friday, there's still a lot we have to figure out. All right, thanks, Joe. Well, Idaho's abortion ban is scheduled to go into effect about mid to late August. That is, unless Planned Parenthood of the Great Northwest has something to say about it. And they have said it shouldn't, saying so for the second time, with another lawsuit filed against the state of Idaho over this trigger law abortion ban. Lawsuit says the ban violates the state constitution because it defies Idahoans' right to privacy and equal protection, citing several other cases where the right to procreate or to choose not to are critical components of the right to privacy. They also cited other cases where the court recognized the Idaho Constitution protecting some degree of personal autonomy. This lawsuit also says the abortion ban is so vague, the part about the prevent the death of the pregnant woman, physicians won't know when they can legally help patients facing a medical emergency, including a miscarriage. Finally, the lawsuit claims the ban will disproportionately impact Idaho's communities of color, those living in rural communities, and people with low incomes who would now have to travel to states like Oregon to seek the care that they desire. Well, should this lawsuit not go anywhere or get decided against, anyone who provides or even tries to provide an abortion could get their medical license suspended, be charged with a felony, and could face up to 5 years in prison. So the first lawsuit we mentioned, remember Senate Bill 1309, the Texas-style abortion bill passed last session that would make providing an abortion a crime, but also hold that provider liable to the woman or the girl's family for a payout. Remember that one? That's different than the one that passed this last session. Well, at least $20,000 per member of the family who decides to sue. That's the liability there for the doctor. That bill was reluctantly signed into law by Governor Brad Little and is still waiting for a determination by a court. You've likely seen or been told by someone in the service industry, whether it's the clerk at the grocery store or the wait staff at your favorite restaurant, sorry for the wait, we're sort of short-staffed at the moment. Well, it's been a topic we've been covering extensively over the last 2 years, and it seems no industry out there in Idaho is immune, and that includes hospitals and healthcare systems. According to the Idaho Business for Education, roughly 9,000 healthcare jobs in Idaho are unfilled. Idaho Business for Education CEO Rod Grammer went as far as to call this deficiency a crisis, and a crisis that needs a solution. Well, healthcare experts across our state discussed some of those solutions today at Boise State. How to retain current staff, how to recruit new staff, and create interest in the industry in general. Here's Andrew Bartline.
It's a big question for young adults to answer.
Have you thought about what you want to do as a career?
I kind of wanted to go into real estate.
Do something with filming and photography.
Hardware set of computers, just something with computers.
And the workforce needs them. A recent report from the Idaho Department of Labor says 2.7 jobs are posted for every one unemployed Idahoan.
You can't drive around anymore without seeing business closures, staffing shortages, and healthcare certainly not immune to that.
St. Luke's president and CEO Chris Roth says the healthcare industry has been short-staffed for years. At any given moment, his hospital system has 5 to 8% of jobs unfilled. But at peak COVID levels, St. Luke's saw 12% of their jobs unfilled. That's more than 2,000 vacant jobs in total.
There's absolutely no evidence that vaccine mandates or requirements had any impact on the workforce challenges and shortages. I think there's a greater body of evidence of the fact that healthcare workers, particularly frontline healthcare workers, went through an incredibly traumatic period.
As you can imagine, there's a domino effect that the more we're short, then the people that are working harder, and then it gets harder to recruit because people see it as a very difficult field.
Healthcare leaders from across the Gem State filled up the Boise State Alumni Ballroom to discuss solutions. St. Alphonsus Executive Medical Director, Dr. Patrice Burgess, says the industry needs to create interest among young adults to choose a career in healthcare.
That every single day, you know, no matter what role you play in healthcare, that you've made a difference in someone's life.
But some kids just aren't into it.
I've thought about that a lot. I really like the idea of helping people. It seems like it'd be very overwhelming for me. I don't think I could handle the stress and the kind of horror of it.
My mom's a nurse, so a little bit, but it's not really my thing.
It's a delicate line to walk. The choice between supporting the stressed staff already in place and sending resources to pull in new talent.
There are indications that the interest of pursuing a profession in healthcare is waning a little bit.
Healthcare leaders don't think these problems will last forever. Experts on the panel say the industry needs to reevaluate how they recruit workers. The panel says it's important to consider candidates from all walks of life and ability and not just seek out the perfect student academically.
Healthcare is open to everyone, and as a matter of fact, we need more healthcare workers that look like the population.
It's a strategy leaders in the Idaho healthcare industry are willing to try, all in an effort to find the right candidate.
Hopefully graduating with my EMT certification.
To find people like Avery Ellsworth, who might blend in among a crowd of her peers, but is more than willing and capable to stand out and answer the call.
Helping people in general is kind of fun, and then I took an EMR course earlier this year, and that was really fun too, so I was like, I want to do it.
This isn't just a shortage of doctors and nurses. This is for IT workers, HR departments, top to bottom. Hospitals have a wide range of jobs they need to fill, and they're desperate to collaborate and get those jobs filled, which we heard today was actually a slight positive from the pandemic, Brian. Hospitals, now more than ever, at least in these panelists' careers, say are in close communication with each other, something that really wasn't needed before, but is certainly in place now.
And it's certainly going to be an industry to keep an eye on over the next couple of years, especially with some of these rules and, of course, the pushback we've seen during the pandemic, but the new rules and laws that are being put in place to kind of monitor what medical health providers are able to provide. It'll be interesting to see who wants to get into that career.
There's a lot of nuance there for sure.
All right. Thank you very much, Andrew.
Boise may be the city of trees, but there's also a lot lower vegetation that needs care. So a group of volunteers are working weekly to make sure there's, well, enough buzz to keep the area lush. All right, if you haven't already, we want you to join the 208 conversation. We want to hear from you. You got a question for the 208 team, or maybe a comment you'd like to pass along? We make it pretty easy to connect with us. Just text the number on your screen, 208-321-5614. And don't forget, include your name and the hashtag, the 208. Oh, and stick around because we could share yours at the end of the show.
All right, think of a flowering plant that isn't, well, a flower. What if I told you anywhere between 75 and 95% of all flowering plants, they need help with pollination? Pollinators are needed for things like fruits and vegetables. And how about this stat? 1 out of every 3 times you take a bite of food, the only reason that food is on that fork is because of a pollinator. And we're losing pollinators at an alarming rate. Loss of habitat, use of chemicals, changing climates, they've all added to the decline in pollinator populations in the United States. Well, if knowing is half the battle, the other half is doing, and there's a group doing what they can to help pollinators. And they do it more often than just during Pollinator Week, which is what we're in right now.
Once a week,
this is penstemon.
There's a certain buzz about one of Boise's small public spaces.
This is the Warm Springs Pollinator Garden.
Yeah, it does grow really fast.
They're cutting back flowering plants.
And we're protecting habitat for the very beneficial pollinators.
And cutting out...
This one is terrible.
Invasive weeds.
There's no shortage of weeds. You'll never run out of them. It's a goat head. It pops bicycle tires. It damages paws everywhere. And they just spread everywhere.
They call themselves...
This is called blue flax.
The Pollinator Posse.
It is a lot of fun. You meet a lot of great people who put a lot of effort into maintaining this and beautifying our city.
The Warm Springs Pollinator Garden is one of 8 scattered across the city of Boise, primarily preserved by a bevy of volunteers.
And it's nice to get out here before it gets to 100 degrees.
We really couldn't maintain these spaces or even plant them without volunteers. This time of year, it's essential. We just really couldn't do it.
They do it because, like Connie, it's kind of a calling.
Usually walk by here on the green belt, and it just seemed like a good way to get involved with the Boise Parks and Rec community.
A lot of people, when they think about pollinators or saving the bees, they think of the honeybee.
And bees are a big part of pollination, a really big part.
A lot of people don't realize we have somewhere in the realm of 700 species of native bees in Idaho. That's not pollinators, that's just species of bees.
But there's also butterflies and...
A lot of beetles are pollinators, people don't realize. There's a lot of different species of wasps that are pollinators. And then we also have a lot of hummingbirds out here. Pollinators are very diverse, it's not just bees. All of our pollinator gardens are weeded by hand. We don't use any herbicides or pesticides at all in our pollinator gardens, just to protect the health of the pollinators.
So it can be a lot of work, but it's well worth it.
I think these gardens bring a lot of joy to people, and I can say, having had the opportunity to work out here with volunteers, the people of this community who go by on the greenbelt are always saying thank you. We love this space. It brings us so much joy.
Get your vitamin D, and it's digging therapy.
It is digging therapy. If you want to take part in that digging therapy, there's a way for you to be part of the Pollinator Posse. You just go to the City of Boise website and look for the community education section, or you can just look for the story on our website at KTVB.com a little later this evening, and it will include a link to take you right there. There are upcoming Pollinator Posse dates where you can help maintain one of the city's 8 pollinator gardens. Unfortunately, none of them are on Broadway, so no, there is no Pollinator Posse on Broadway. right, hottest day of the year was yesterday. Today, still hot, just not as hot. And if there's a difference between that much, whether it's that kind of heat or a different kind of heat, you probably have already experienced it if you're new to the state of Idaho. You hear this term when you move here, probably like, well, at least it's a dry heat, right? Because we're in a high desert. We wanted to bring in meteorologist Bree Eggers to explain what is this dry heat excuse, if you want to call it that, that we're talking about or hear about a lot.
Still hot.
Yeah,
Still
it is.
hot. We won't take that away. But
Nope.
yeah, there is a difference in how it feels, and it all comes down to how much humidity is around. Now, we talk about relative humidity a lot here locally, especially when it comes to this time of year when you're talking about fire management. But as far as how much moisture in the air and how it makes you feel is concerned, really it's better to look at the dew point temperature. It's the temperature that the air needs to reach in order to become completely saturated. So for example, in Boise, the dew point's 27. The air temperature would have to cool to 27 in order to see dew forming on the grass. Now, you take it down to the southeast where humidity slaps you in the face the second you step off the plane, and you've got dew points that are in the low 70s. So certainly feeling that moisture in the air and feeling that tropical humidity down there, and a lot of times across the eastern seaboard as well. So that moisture in the air also keeps our temperatures from reaching long ranges of daily temperatures. The last 20 hours in Boise, we were at 104 yesterday for a high, and then we dipped down to the mid 60s. That's almost a 30-degree, 40-degree difference in lows to highs in the afternoon. Now compare that to Miami, Florida. You're talking about a 20 to a 30-degree difference between lows and highs because there's so much moisture in the air. So when we say at least it's a dry heat, what does that mean exactly? So you got your little guy right here. So picture that. That's Brian Holmes. At least it's a dry heat. He's trying to regulate his body temperature to 98.6 degrees, and we sweat to do that. The reason why the sweat helps us to regulate our body temperature is because it evaporates into the air, and evaporation is a cooling process. It's called evaporative cooling. So when the air is dry, it'll gladly take your sweat and it'll cool you down and you can regulate your body temperature. But when you have high dew points, you have a lot of humidity in the air is too primed with water vapor or moisture in the air to take any of your excess sweat, so it just tends to stick to you, and so the sweat sticks to you, the heat tends to as well. It can certainly feel much hotter. At least it's a dry heat. And if you want to see that 7-day forecast, you can find it at ktvb.com.
Our final minute of the show here on this Tuesday. Let's get to your comments. Are they called trigger laws because guns have more rights than women in those states? Ask Rod in Boise. See what you did there, Rod. But no, it's triggered because, well, the Supreme Court overturned it. Therefore, the trigger was pulled, and now we're faced with the consequences. The Idaho abortion trigger is the law of unintended consequences, says Tam. They have no idea what they did. And we heard as much last week because there's a lot of this that still needs to be sorted out when it comes to what happens criminally for the physicians. Wasn't there a time when folks went to Nevada for a divorce and they were legal when they got home, right? Asked Cecil. Yeah, there was a time. They went to Mexico, they went to Nevada, quickie divorce. You ever heard that phrase? Yeah, and they counted for here. Not so much, well, I guess it would be. If you go to another state for an abortion, it's still an abortion when you get back to Idaho. You can't get an abortion in Idaho, but you can buy illegal fireworks at a local stand. That's correct, right, Janet Meridian? Yes, but Janet, they sign a paper that says they won't shoot them off here in the state of Idaho. And they all follow. They all keep to their word, don't they? We'll see you back here tomorrow.